Today in this video, I'm going to be talking about nephrotic syndrome. So the definition of nephrotic syndrome is it is a clinical syndrome of massive proteinuria, which is defined by edema, hypoalbuminemia, which is less than 25 gram per liter, proteinuria, more than 40 milligram per meter square per hour, or urine protein creatinine ratio of more than 200 milligram per millimole, and also hypercholesterolemia. These are the few criteria to diagnose nephrotic syndrome. The clinical features of nephrotic syndrome. For symptoms, the patient might present with facial swelling, which is the earliest sign. Breathlessness, which means shortness of breath, might be due to pleural effusion and abdominal distension. And also, they might complain of decreased urine output. For signs, we will be able to see periorbital edema, ascites, scrotal and leg edema, and also signs of pleural effusion, like if there is ipsilateral reduced chest expansion, or there is stony down on percussion, and if we auscultate, we can hear some bronchial breath sound just above the pleural effusion. To investigate for nephrotic syndrome, we can do full blood count. To look at the white cell count level, if it is high, it suggests infection. Second, we can do renal profile to look for hyponatremia, and there might be raised urea and creatinine levels. Other investigation that we have to do is to see whether they meet the criteria for nephrotic syndrome, which is serum cholesterol level, liver function test, especially serum albumin, because if there is hypoalbuminemia less than 25 gram per liter, we will be able to say it is nephrotic syndrome. And also, one more investigation is urinalysis, urine culture, or to quantify the urine protein, we can do urine protein creatinine ratio. So I'll go through the definition of a few terms that are important to note in nephrotic syndrome. The first one is remission of nephrotic syndrome, which means that the urine dipstick is trace or nil for 3 consecutive days. Trace means the proteinuria is less than 2+. Second is relapse of nephrotic syndrome. It means when the urine albumin excretion is more than 40 milligram per meter square per hour, or the urine dipstick shows 2+ or more for 3 consecutive days, means there is a relapse. Thirdly, the steroid-resistant nephrotic syndrome. This is because the mainstay of treatment for nephrotic syndrome is steroid. So if there is steroid resistant, it means there is failure to achieve remission despite giving 4 weeks of adequate corticosteroid therapy. Later I will go through about the treatment, and you will see why it is 4 weeks. And fourth, it is steroid-dependent nephrotic syndrome, which means there is 2 or more consecutive relapse occurring during the steroid taper or within 14 days of cessation of steroids. So next I will go through about the treatment for nephrotic syndrome. The initial treatment, when they first presented with nephrotic syndrome, the treatment will be prednisolone therapy, 60 mg per meter square per day for 4 weeks. And then after that, the next 4 weeks, we will give prednisolone 40 mg per meter square per EOD. EOD means every other day, so maybe 2 or 3 days once, for 4 weeks as well. And then after that, we taper down the dosage over 4 weeks and then stop the treatment. With this initial treatment, 80% of the children will achieve remission within 28 days. So usually within 4 weeks, there will be remission already. But like I said just now, if in steroid-resistant nephrotic syndrome, there will be failure to achieve remission despite 4 weeks of adequate corticosteroid therapy, which means even after 4 weeks of this 60 mg per meter square per day prednisolone therapy, they still fail to achieve remission, which means there is still proteinuria present. Okay, moving on to treatment for relapse, which means the urine dipstick is 2+ or more for 3 consecutive days. So the treatment is slightly different from the first time presentation. For relapse, we treat with prednisolone 60 mg per meter square per day until remission. So unlike the initial one, we treat for 4 weeks, this one for relapse, we treat until remission. And then after that, we give prednisolone 40 mg per meter square on every other day for 4 weeks, and then we straight away stop the treatment. So for complications of nephrotic syndrome, the first one is hypovolemia. This is due to the loss of protein in urine. So this will reduce the oncotic pressure and increase the hydrostatic pressure. So water will move into the third space, and this will cause hypovolemia. Some of the signs of hypovolemic shock are abdominal pain, cold peripheries, poor pulse volume, and also hypotension. The second complication is primary peritonitis. This is because when the water moves into the third space, it will cause ascites, and there will be abnormal fluid accumulation in the peritoneum. So this is a very suitable medium for bacterial growth, and it will cause spontaneous bacterial peritonitis. And the signs to look out for is fever and abdominal pain. Third complication is thrombosis. This is due to the urinary loss of antithrombin and also increased synthesis of clotting factors. Okay, so that's all for my video. Thank you.